call Dr. Mohammed Akbar. So, comparing posture changes of IOP in normal and glaucomatous eye in Indian population.
Very good afternoon, judges. My title is Comparing Posture Changes of Intraocular Pressure in Normal and Glaucomatous Eye in Indian Population. In increased intraocular pressure has been identified as an important risk factor for the onset and progression of glaucoma. Posture is one factor that has longer effect on the intraocular pressure. The posture changes from the sitting to the supine can increase intraocular pressure significantly with this IOP. Fluctuations suggested to be related to the structural and functional deterioration in glaucomatous eye. Primary open-angle glaucoma is the most predominant type of the glaucoma in the world. It is well known. Among other risk factors for primary open glaucoma, rise intraocular pressure is the commonest, and at present, the only risk factor that can be modified is the IOP. M is posture changes in intraocular pressure in normal and glaucomatous eye of Indian population. The objective is to assess posture changes in the intraocular pressure in the normal and glaucomatous eye of the eye. The study material is a case control study. It is carried out at Tertiary Care Hospital in Western Maharashtra. The sample size is around 60, total 60. 30 group 1 is the 30 subject for primary open glaucoma and 30 for the normal eye. The position is parameter is sitting with supine flat position and sitting with supine with pillow and supine flat with supine with pillow. The inclusion criteria is for the primary opening glaucoma is open interchamber angle. There is SAFA grade 3 and 4 in all the quadrant, and there is a rise intraocular pressure greater than 22 mm of Hg, and vertical cup disc ratio of about greater than 0.6 mm or symmetry asymmetry of the disc cupping equal to or greater than 0.2 with or without the flowing disc changes, a rim notching or thinning of the rim, disc hemorrhage or violation of the ISNT. To rule out dilated fundoscopy by using the 90D in on both eye. And characteristic glaucomatous visual field defect, that is nasal steps, paracentral scotoma, or double arcuate decodum by using the Humphrey visual field analysis. For normal eye, there is non-glaucomatous patient. Vertical cup disc ratio is less than 0.6, and there is no disc symmetry of less than 0.2. There is no rim notching or thinning of the rim. No disc hemorrhages or violation of ISNT rules. And the IOP should be less than 22 mm of Hg after pachymetry. Exclusion criteria: there is a participant is participant is greater than 30 years and diagnosed with POG before the studies, and types of glaucoma other than the glaucoma POG, and previous ocular surgeries, intersegment pathologies such as acute and chronic uveitis, any corneal abnormalities that will prevent reliable of IOP measurements such as corneal opacity to be ruled out, diabetes, hypertension, and subject on medication which is known to influence the IOP to be ruled out. A case control as match study was conducted in 30 successive newly diagnosed POG and 13 normal eye, and the IOP eligible correspondent one measure with Parkin's hand tonometry in the sitting position, supine flat position, and supine flat with pillow position respectively. Measuring of IOP in this position was done after 15 minutes of assuming each such posture. The results, the IOP differences between the sitting and supine flat positions was significantly higher in primary open glaucoma than normal subject. That is 5.06 plus minus 0.9 versus 6.01 plus minus 0.8. The p-value is less than 0.001, which is very significant. The IOP difference between the sitting and supine with pillow position was 1.36 plus minus 0.14 for primary open glaucoma and 2.8 plus minus 0.34 in non-glaucoma, and the p-value is 0.001, which is also significant. The difference between the supine flat position and supine with pillow position plus was 3.7 plus minus 0.23 in primary open glaucoma and 3.2 plus minus 0.51 mmHg in normal patient. The p-value is 0.001. And this is this graph shows that the blue one is the newly diagnosed primary opening glaucoma, and the red one is the normal eye, which is very significant in the graphs. And here, this is the IOP is the lying position with pillow in the newly diagnosed primary opening glaucoma, and the red one shows that they are lying with pillow with normal eye. The same here. And to be conclusion, greater variation in the posture-induced IOP occur in primary opening glaucoma patient than non-glaucomatous. The posture-induced IOP variation is the lowest in the sitting position and highest in the supine flat position. Evaluation of posture-induced IOP changes may be important tool in the management of glaucoma. Thank you.
Thank you. I'd like to ask you, in this situation, you just advise to the patient to avoid the pillow. You have to allow the patient to sleep in a supine position, but pillow can be avoided in the case of glaucoma.
Yes,
that is the only clinical came out.
Yes.
So were they on any medications, these patients?
No, sir.
No
any
medication.
medication.
So same day diagnosed, same day visual field,
Yes.
gonioscopy,
Yes.
dilated exam also was done on that day.
Yes.
So IOP on after dilatation may vary then.
Pardon me?
IOP after dilatation
Yes,
may
ma'am.
vary, that means.
There is variation, ma'am, actually.
So you may have to write that in the drawbacks. No?
Yes. Ma'am.
Why did you not include the standing postures? Only sitting
Actually, ma'am, standing person might be due to some hypertension. There may be posterior hypertension also may be there. So it is better to be avoided, sir. Actually.